Across America and across CNBC, we're taking a closer look at how states are faring when they lift coronavirus restrictions. The data are very new, but we've already seen some different trends emerge, with government officials trying to balance the health of the state economies and the health of everyday Americans. Since Mississippi began reopening back on April 27th, it's seen a 61% increase in cases, an average of 256 cases per day, and one day last week they saw their highest number of deaths yet. This is all happening as testing has increased in that state by 34%. Of all those tested in Mississippi, 12% have come back positive. Joining us right now is Tate Reeves. He's the governor of Mississippi. And Governor Reeves, thank you very much for being with us this morning.
Thank you for having me on this morning.
I realize it's a difficult decision to have to make, but the CDC guidelines have suggested that states should wait until they have seen a decline in cases over the case of 2 weeks. What led you to go ahead and say that the state needs to open up earlier than that?
Well, there are a number of reasons. Number one, when you look at a state like ours, we never really had a peak per se. For the last 35 days, we've had a relatively consistent number of cases. And what we've seen over that same time period, we've had a relatively consistent total number of cases, while at the same time significantly increasing testing. Mississippi has been a leader from the beginning on testing. We have been early on in the top 5 to top 10 states in terms of testing per 1 million population. We've now tested almost 35,000 per 1 million population in our state. The other thing that leads us to make that decision is the fact that we have a public health disaster in our country going on. There's no question about it. But at the same time, we have an economic disaster in our state and across this country. In the last 7 weeks, we've seen 200,000 Mississippians file for unemployment. That's approximately 16.4% of our workforce. And there's just a large number of people that are just begging to get back to work so that they can provide for their families and put food on the table for their kids and grandkids.
You have given these openings with conditions. You say that businesses have to be careful. There are pretty strict rules that they're supposed to be following through some of these things. We've got Mark Cuban coming on a little later this morning, and he conducted his own secret shopping survey of restaurants in Dallas to find out if they were following some of those guidelines. And it came back that something north of 95% of those restaurants were not. How do you check to make sure that businesses are following the guidelines that you've issued?
Well, we have a partnership with our local law enforcement officers, and we are also supporting them with state resources and state assets if and when they ask for it. There is no question that we're not going to get 100% of our people to follow the rules, but we don't get 100% of people to follow our murder laws either in this country and in this state. And so I believe that the vast majority of Mississippians are understanding that we do still have challenges before us with respect to the virus. When you go out in our state, people are experiencing and doing social distancing. They are doing the right things when it comes to restaurants reopening and making sure they're only opening at 50% maximum capacity. We're allowing restaurants to serve outdoors because when we talk to our public health experts, they make it clear that seems to be significantly less risky than if you had hundreds of people in a very tight space indoors. We want to make sure that we don't get into groups of more than 10 indoors. And so what we find is that the vast majority of Mississippi businesses and the vast majority of Mississippians are adhering to the standards that we've put in place. And you're exactly right. They are very strict. They are onerous. They are put in place with the thought being we can both protect our people from the virus while at the same time protect our people from the economic disaster that is going to happen in many places across the country.
Governor, obviously, it's a heavy decision to make to try and have to weigh people's health alongside their economic health. What would make you tighten restrictions? Is there a level in your mind that would be unacceptable when it came to some of the cases coming out?
Well, I'll tell you, every single death is unacceptable, and every person who gets the virus is unacceptable to us. What I would tell you is that we did have the largest number of cases on Thursday that were reported. That was 404. But on Friday, Saturday, and Sunday, we had 220 cases, 170 cases, and 120 cases in each of those 3 days. And so when you really can't just look at individual cases on a day-by-day basis because reporting is sporadic. Sometimes we get data dumps, for instance, from out-of-state labs. And so what you've really got to do a good job of is having contact tracing in place. We have had that from the beginning in our state. We are contacting every single person who gets the virus. We are making sure that we quarantine them, that we self-isolate those individuals who have come in contact with those individuals that have tested positive. We're going to continue to do that. We think it's critically important to slow the virus. And what we look at, and our goal from the beginning was we had to make sure that every single Mississippian that could get well with proper treatment received that proper treatment. So our goal was to focus on our hospital capacity. And what we found is that we have less than 600 total patients hospitalized in Mississippi with COVID-19. We have less than 150 patients that are in ICUs, and we have less than 80 patients that actually are on ventilators, which means we have approximately 90% of our total ventilators still available. And so every single Mississippian that can get quality care can get better with quality care will be able to do that. Our healthcare system is not stressed, and that was our goal from the beginning, and we're going to continue to monitor that.